So let's talk a little bit about dose. There's been a lot of talks this week about dose. In the real world, our CT dose is in the Z direction is a Gaussian-shaped profile. We have tails. We have a peak dose. As a result of that, we can define what we call the CTDI, which is of course, the integral under this profile, and we characterize it by the full width at half maximum, and of course that's equal to the product of n times t, where n is the number of detectors in the Z direction and t is their width. As physicists, we go into facilities carrying our CTDI phantoms made out of PMMA, either 16 or 32 centimeters in diameter. We put pencil ionization chambers in the various holes of these phantoms, and of course we make measurements, and we plug the holes that the chamber is not in. For those of you that have never done any of these measurements, this is what the CTDI phantom actually looks like. The smaller 16 centimeter phantom represents the head, and of course it would go in the cavity of the 32 centimeter phantom shown here, which represents the body. This is just a picture of the 100 millimeter pencil chamber that's typically used, and then of course we know that we take the surface and the central measurement of this procedure, and we use this weighting factor as shown here to calculate CTDI vol. So what does CTDI vol tell us? Well, it tells us if we